Hi class, welcome to my signature assignment, hemochromatosis. Hereditary hemochromatosis is a genetic disorder in which the body stores too much iron. The substitution mutation occurs in homozygotes in the HFE gene, in which the nucleotide guanine is replaced with adenine. This amino change goes from a cytosine to a tyrosine, creating a C282Y mutation. The mutation prevents the HFE protein from interacting with transferrin receptor 1, which imports iron to the cell. As a result, iron regulation is disrupted and too much iron is absorbed from the diet. It is often described as a Celtic mutation originating in Celtic population in Central Europe and spreading west and north through population movement. The European countries with the highest prevalence include France, Denmark, and Ireland. The C282Y homozygotes account for 82 to 90% of people of Northern European descent, and in 2016, the incidence of C282Y is estimated to be 5,400 cases per 10,000. The prevalence of hemochromatosis is 6 times higher in white persons than in black persons. This is a diagram of the organs that are affected by iron overload, which is also like part of hemochromatosis. This includes the pituitary gland, thyroid and parathyroid gland, heart and circulation, liver, the adrenal gland, pancreas, ovaries, and testes. Too much iron in the body can be toxic and disrupt different organ systems and organs. In the heart, it can cause arrhythmia and heart failure. In the liver, cirrhosis, enlarged liver cancer, and liver failure. In the joints, arthritis and joint damage. It can cause diabetes. In the as far as the reproductive system, it can cause erectile dysfunction in men and early menopause for women. It can also cause problems with the spleen, adrenal glands, pituitary gland, gallbladder, and thyroid. And skin normally looks more gray and bronze than a usual normal color. Some signs and symptoms of hemochromatosis include feeling tired or weak, some joint pain, loss of sex drive or erectile dysfunction. It can cause some liver pain, which is right upper quadrant abdominal pain or right flank pain, and then some coloring of the skin, which is a gray or bronze color, or including jaundice. Patients with severe iron overload may experience signs and symptoms of cirrhosis, diabetes, and CHF, and this includes nausea, vomiting, altered mental status, which is confusion, memory loss, and sleep disorders, jaundice, edema of lower extremities, excessive urination, thirst and eating, high blood sugar, and shortness of breath with chest pain. A study was done over a 30-year period, and the mortality rate of hemochromatosis-associated hospitalizations was 2.3 per 100,000 persons in the United States. There really wasn't many mortality rates associated, but left untreated, hemochromatosis can lead to CHF, diabetes, and cirrhosis, which is all chronic conditions. Regarding the diagnosis of hereditary hemochromatosis, you can take some tests, including blood tests. Serum transferrin saturation measures the amount of iron stored in your blood. Transferrin saturation greater than 45% is considered too high, and serum ferritin measures the amount of iron stored in your liver. Some additional testing include liver function tests, and it identifies liver damage, an MRI to measure the degree of iron overload in your liver. You can take some genetic testing, which tests DNA changes and the HFE gene, as we mentioned earlier. And then they can also do a biopsy, removing some of the liver to see if there's any damage. In regards to the treatment of hemochromatosis, there really is no cure. It's more just management throughout a lifetime, but it is very manageable. An example is therapeutic phlebotomy. Is basically blood donation given every 2 to 3 months, and you just got to do this frequently. Also, iron chelating medications, which medication, it binds iron and allows it to pass in the body through the urine. And some examples of prescription medications are deferomaxine and deferacero. And then some diet and nutritional supplements, including avoid eating raw and uncooked fish, avoiding eating supplements with iron, avoiding supplements that contain vitamin C, and those with cirrhosis need to avoid drinking alcohol. Artificial intelligence can help patients with hemochromatosis by detecting the signs of the disease in its earlier stages and by scanning the genetic mutation in the DNA. The AI can also look for inflammation markers in the blood samples from patients, and then it analyzes to see if there's abnormal iron levels. And if there is abnormal iron levels, AI recommends follow-ups to make sure there's no iron buildup in any other organs or any other place in the body. And AI can also use machine learning to learn about a patient's habits when managing their healthcare, and it can essentially recommend treatment plans based on the patient and to their unique needs. These are all my references for my hemochromatosis signature assignment. Unfortunately, all my citations are behind my little square camera right here I placed at the bottom corner, so I can't really see them in this presentation, but they're there. And thank you for stopping by and listening in. You guys have a great day.